Welcome to the HPTN Network Laboratory. The HPTN is divided into 3 cores. One is housed at FHI, the other is at Sharp in University of Washington, and the HPTN Network Lab is at Johns Hopkins. We are divided into a QA/QC core and a laboratory core. Our laboratory core is divided into virology, HIV incidence, STD microbiology, immunology, pharmacology, toxicology, and point-of-care testing. We will be talking during this presentation on the QA/QC core. The HPTN Network Lab provides support for many domestic and international protocols. The Network Laboratory is centralized at Johns Hopkins University and Johns Hopkins Hospital under the leadership of Dr. Susan Eshelman and Estelle Pior-Manning as the Deputy Director. There are 14 investigators and numerous support staff. 8 of our investigators are certified clinical pathologists. The laboratories are housed at the School of Medicine, at the hospital, and the School of Public Health. We have over 36,000 square feet of space with 7 CLIA certified laboratories and 3 state-of-the-art HIV research laboratories. High-quality laboratory performance is important for the integrity of our HPTN trials and the safety of our trial participants. The QA/QC core of the Network Laboratory has over 20 years of experience working with laboratory QA/QC at U.S. and non-U.S. CTU and CRS laboratories. We also have experience in laboratory support of large community randomized HIV prevention trials. Our staff consists of certified medical technologists, including 5 who are placed at our non-U.S. sites. We have the extensive capacity for QA/QC testing, and we provide site support and on-site coordination for our protocols. The QA/QC core based at Johns Hopkins University are members of protocol teams. We are responsible for the development of the protocol as well as the study-specific procedures section for the laboratory, HIV algorithms, and also we provide training for the protocols. We take part in the QA/QC testing of our protocols, we provide site support, and we perform specialized HIV testing. Our core has also been responsible for the production of training videos and laboratory practices. We specialize in laboratory specimen management, freezer management, and international shipping. On this slide, you will see members of the QA/QC staff. We are affiliated with over 20 sites internationally, as shown on this slide. We currently have 5 medical technologists internationally, 1 in South America, 1 in Asia, and 3 in Africa. As part of our ongoing training effort, the QA/QC core has made training videos. These are available at the hptn.org website on the Network Lab page. In this slide, you see the pre-activation requirements. The Network Laboratory will do a site visit to understand your clinic workflow. In this slide, you see the pre-activation requirements. The Network Laboratory will do a site visit to understand your clinic workflow and to see how samples will go from the clinics to the laboratories you have chosen to work with. We may ask you to complete a protocol analyte list known as a PALS or supply us a clinic flow plan. From this information, we will make sure that you're enrolled in the appropriate external quality assurance. We will also be checking, as indicated in the U.S. sites, for CLIA licensure or waivers as needed for the protocol. We want to make sure that LDMS has been installed at your site and the appropriate staff members have been trained. One member of staff, usually the laboratory supervisor or manager, or possibly the QA personnel, should have completed the Good Clinical Laboratory Practices training. This training can be obtained online or at a regional meeting. Staff should also complete safety training based on your institute. Staff will be required to be trained in IATA regulations. This is done every other year, but with an annual review. It is also possible that there will be a laboratory audit conducted by a contractor of Danes. The LDMS is used in all of our protocols to track the collection, storage, and shipment of laboratory specimens tested at the HPTN Network Laboratory, or those that are stored for future analysis. Study Specifics Procedures Manual is provided to each of the sites along with the protocol. The laboratory has a specific section, and in that section we will include the LDMS codes to be used for the protocol samples. In addition to the pre-activation requirements, there is a list of activation requirements. This is an example shown on this slide. We want to point out that we will be reviewing SOPs for clinic-related testing and also will be reviewing the specimen chain of custody.
Each site has to have a chain of custody specific for each HPTN protocol. This will include details such as specimen collection, specimen transport, processing, testing, storage and disposal. For further details, please see the specimen management training video available on our website. Specimen collection must also be well documented. Multiple blood collection tubes could be used throughout your study. It's therefore important to have the correct order of draw documented and make sure that this is followed by all staff. Information regarding the correct order of draw is available from the blood tube manufacturer. For all specimens that need LDMS storage, there is an LDMS specimen tracking sheet available from Sharp. This will be used as part of your chain of custody.
During the course of the study, we will be reviewing each site's monthly LDMS reconciliation reports and responses. We will also be ensuring that the HIV algorithm for the protocol is being followed correctly. In some cases, we may review inventory summaries, and we also may review QC reports for protocol-specific assays. During the course of the study, 10% QA will be performed on enrollment samples as per the HPTN Manual of Operations, which is available on the HPTN website. The HPTN QA staff will also conduct periodic site visits. We require that the laboratory manager, QA/QC coordinator, or a designee at each of the processing laboratories and the clinic site personnel review on a weekly basis the LDMS tracking sheets, the LDMS data entry, and the clinic collection and CRFs, just to make sure that everything is accounted for during that week. The processing laboratories are responsible for exporting their LDMS data to FISTRF. FISTRF in turn will transfer that data to Sharp.
The clinic will submit data on a case report form to Sharp. Sharp will compare this data to the data they have from the LDMS. If this data does not match, Sharp will send a discrepancy report to the site. Both the lab and the clinic will review those discrepancies. Resolution of the discrepancies may involve amendment of data in the LDMS or amending the CRFs, which will be faxed to Sharp. A summary of this resolution will also need to be sent to the network lab. Weekly meetings between the lab and the clinic should help reduce the number of items listed on this Sharp error report.
We also perform HIV QA testing as per the HPTN Manual of Operations. You can find the Manual of Operations on the HPTN website, which is listed on this slide. In order for the network lab to perform the quality assurance testing, Sharp will inform the site staff of which samples have been selected. The site staff will coordinate the shipment of the samples to the network laboratory. These must be accompanied by an LDMS manifest and shipping batch. During the clinical PPD audit, samples will be verified in the LDMS and in the actual storage locations. At the end of the study, shipments will continue and most of the network laboratory testing begins in earnest. There will also be a study closeout procedure, and that is to ensure all testing has been completed. Thank you for taking the time to review this presentation about the network laboratory. If you have any questions, comments, or concerns, please contact the Network Lab Quality Assurance Coordinator who has been assigned to the protocol. You can also email Estelle, or you can ask for assistance through our group logon at hptn-lab@jhmi.edu. Again, thank you for taking the time to review this presentation.